Today let's talk about low back pain, pain science, myths, and some straight up facts. The number one rule if you have low back pain is don't panic. Most low back pain resolves on its own without treatment, and most of the things that people scare you about really don't matter that much. Everything you think you know about back pain is probably a lie. Today we're going to talk about your journey, the hero's journey. You are the hero of your own story, and you have to slay the dragon. We'll talk about the obstacles in your way and how much they matter and how you can overcome them. I'll teach you how pain is multifactorial. It's not just boiled down to a single cause, so if somebody tells you they can fix the root cause of your pain, they are lying. And then we'll do some myth busting and reassurance, because fortunately, in this case, the truth is actually much more reassuring than the scary lies that people tell you about your back. Having proper education about low back pain is super important because it is the number one cause of disability worldwide. Part of the reason that it is so bad worldwide is because it is so badly mismanaged. People are just not following clinical practice guidelines. They are giving excessive and unnecessary treatments of all kinds, and it is not warranted. A little education really does go a long way when it comes to low back pain. First of all, you are the hero. You are the hero of your journey. You are on a journey and you need to slay the dragon. Especially if you've had chronic pain, there are going to be a lot of obstacles in your way. Some of them are physical, some of them are going to be mental and emotional, and some of them are going to be societal. Some of them are going to have to do with money or support or friends. And of course, pain and weakness and fatigue, and all these things are obstacles in your rehab. Now, just as in any good story, you are the hero, you're trying to slay the dragon, you probably need a guide. Now, I happen to be a guide, but there are many guides out there. People who can help guide you on your journey towards rehabilitation and functional activity include physical therapists, chiropractors, counselors, nutritionists, friends, family, coworkers. All of these people will have an influence on guiding you along your journey. Now, I am a guide, and I have to include this slide because this is technically a school presentation. And the grading rubric required it. But this is not about me, this is about you. Yes, I have some fancy stuff, I've got a bunch of papers on my wall. But even if you work with me one-on-one, my role is to help you, because you are the hero. Let's talk about you. You have pain. Chronic back pain, possibly. But I will say that a lot of the education in this slide happens to pertain to most chronic pain. So this is you. And you have pain, and you may feel as though you need to make a decision. Part of you wants to return to normal life. You want to be able to exercise, or you want to do some activity that currently you are unable to do due to pain. But you might be afraid that if you return to activity too quick, or if you do the wrong kind of activity, that you will hurt yourself. So you don't want to hurt yourself. You may feel that these are two mutually exclusive paths, and that is a crappy choice to have to make. You do not have to choose between getting back to normal life or avoiding hurting yourself. In fact, research has shown that fear of pain is actually more disabling than pain itself. So remember rule number one, and don't panic. Now let's talk about what pain is. Most people think that pain is a sensation, but it is not. Pain is actually multifactorial, and it is more like an emotion than it is a raw sensation. Most people think that pain works a lot like this, that you have an injury and this causes pain. End of story. And when the injury goes away, when you're healed, no more pain. But that's not true. There are many, many cases of people having no damage and lots of pain, or lots of damage and no pain. So here's more how pain really works. Here's the reference for this. So let's say you do get a little bit of an injury. Let's say it's an overuse injury. So you do the same thing too much and that area starts to bark at you. So all we see here is really that the body gets a little bit sensitive. Now maybe you go to a doctor. Maybe that doctor tells you to be afraid that your body is damaged, that it's broken. You should stop moving, go home and rest. Well, this is probably gonna make you pretty stressed out and take away coping mechanisms like exercise, which can be a healthy way to relieve stress. Now stress is amplified, amplifying your sensation of pain. Let's say your pain here prevents you from doing your work or completing your job. Your boss yells at you, you can't get your work done, you're stressed. As a result of your stress, that stress amplifies your interpretation of the signals from your body, and your body actually creates more of a pain experience. If we zoom out even further, we can really get a better picture of how pain truly works. Maybe as a result of pain, you have trouble sleeping. You can't recover and actually heal the tissues that might be a little inflamed and damaged. So you get less sleep. This delays healing, and it stresses you out. You oversleep, so you can't eat a good breakfast, which delays healing and stresses you out. Your stress keeps you from loving and interacting with your family and loved ones, which gets in the way of your work, which gets in the way of making money. And all of these things impact your likelihood to feel pain. Let's say we fix your posture. Now you have perfect posture. Does that guarantee that you are not going to feel pain? No, because pain is multifactorial. Let's look at some straight up facts. Most likely everything you know about back pain is a lie. Most people want to get an MRI of their back to see what's going on. They want to see if their spine is messed up. But actually, that makes pain worse. And MRIs can lie. Stranger danger? Is it unsafe to do unfamiliar movements? We'll talk about some of the things that people think are bad for your back and how actually they're not. Do you need to preserve the curve? Do your spinal curves, does your posture really matter that much when it comes to pain? And then we'll talk about pain and the brain, how the brain interprets our sensations and environments and weighs them against our beliefs and expectations to output an experience, which may or may not involve a sensation that you describe as pain. First up, MRI can lie. MRI findings alone do not predict low back pain. In fact, a study of over 3,000 people found that 80% of people over 50 years old had disc degeneration, and yet they had no pain. So if most people have this stuff that's wrong with their spine, does it really matter? However, the same group then did a follow-up study comparing people with no pain to people with pain, and they did find that people with pain were slightly more likely to have some sort of disc degeneration or disc herniation or something that looked quote wrong with their spine. So it is slightly more likely that you will have some sort of discomfort at some point in your life if you do have something going on in your spine, but most people have some small imperfections with their spine and it really isn't a big deal. So don't panic. Another study tried to identify risk factors that they could use to predict whether a person actually had pain. They found that they could not predict whether or not a person had pain based on their MRI and based on whether or not they had a disc injury. However, and this is interesting, they could somewhat predict whether a person was going to have low back pain if they had depression. Again, hinting at the biopsychosocial nature of pain, the multifactorial nature of pain. Pain is an experience, not a sensation. Next up, stranger danger? Should you be afraid of unfamiliar and weird movements? Well, let's look at lifting. When it comes to lifting, you can lift with a squat or you can lift by bending over and picking things up. And the stresses on the actual spine themselves, biomechanically, are pretty much the same. What about rounding the spine? Is rounding the spine okay? Is it okay to do crunches? Is it okay to pick some things up sometimes with a slightly rounded back? Yes. Yes, it is okay. Researchers have found very little correlation, and some research has found no correlation between posture, rounding the spine, and pain. In fact, flexion or rounding the spine can actually be used therapeutically. Many chiropractors and physical therapists will use something called flexion distraction as a therapy, or they will use other postures like child's pose type postures in order to round the spine in order to hydrate the spinal discs. And this study right here showed that you actually need flexion and extension in order to hydrate your spinal discs. So you don't need to be afraid of rounding your back. What about deadlifting and weightlifting in general? Well, actually, that turns out to be quite safe and therapeutic. It prevents or reduces the likelihood of you experiencing pain in the future, and it makes you stronger and healthier and more functional. Another study here looked at sports and found that sports in general, except for bowling, weirdly, but most sports in general do not seem to have a correlation with increased risk of disc herniations. So the bending and twisting and throwing and heavy intensity of sports not only did not cause more disc herniations, but they actually seemed to be protective against disc herniation. So motion is lotion. Next up, do you need to preserve the curve? A lot of people are really concerned with spinal alignment. Everything's got to be just perfectly in place, like we're some kind of Jenga tower. But guess what? Your spine is not that fragile. In fact, research after research after research, and I could have gone on, continue to find that there is no association between spinal curves and pain. And it's not just spinal curves. It turns out having a short leg also doesn't matter until you have a really short leg. Then maybe you should do something about it. But again, tons of different articles here all show us that most people have a slightly short leg and it doesn't matter. It doesn't influence pain. It doesn't change the curves of your spine. It really doesn't matter. So if somebody tries to scare you, don't panic. By the way, if you want to download my notes, they are available to all members on my website. You can be a member for as little as $5 a month, so go check that out. Next, let's talk about pain and the brain. Remember, pain is an experience in the brain that has many factors, and it is not a sensation. Let's look at some really weird pain experiments. This first one here had patients that had hand pain, and they looked at their own hand while they performed painful movements through binoculars that either made the hand look bigger or they flipped the binoculars so that their hand appeared smaller than normal. Now, metaphorically, this is taking a problem and making it better or worse by modifying what you actually see. And they found that when people's hands appeared larger than normal, they had more pain, and that when people's hands appeared smaller than normal, they had less pain. Super weird. Next up is something called central sensitization or peripheral sensitization. All this means is that your pain alarm system is hyperactive. Your false alarms are going off when a pin drops. This is due to the nerves literally being chemically sensitive. There's no actual tissue damage to speak of, but the nerves themselves are just extremely reactive for no good reason. In this case, you can remind yourself that movement is safe and explore graded exposure to painful activity as your nerves and brain begin to recalibrate. This one is super weird. There was a man who lived, so he was in a car accident and he had the turn lever, which was made of metal, the turn signal lever, stuck in his arm for over 50 years. And for several decades, he had no pain at all. So a metal rod was stuck in his arm and he had no pain for decades. Now, eventually it did start to cause some pain and he did have it removed, but the fact that he could go for decades without any pain and a metal rod shoved in his arm after a car accident is amazing. And it shows you that you can have real tissue damage. There can be something very wrong with your body, and yet you can have no pain at all. And then here's a fun one. They took a metal rod, so this experiment right here, they took a very cold metal rod and they poked people with it and asked them how much it hurt. And before they did that, they showed people either a red light here or they showed them a blue light. And then after they showed them either a red or blue light, they poked them with a cold metal rod and asked them how much it hurt. Now, this was a test to see our implicit beliefs, our cultural understanding of these colors, right? Red is usually associated with danger, stop, warning, or blood. Blood is red. So our subconscious beliefs about the color red are that red is bad, and blue is the opposite of that. Generally, blue things are safe. Well, they found out that when they poked people with a metal rod after showing them a red light, it hurt a lot more than if they had shown them a blue light. So context matters. Legitimately, this even means that the environment that you go into, the colors of the hospital walls or the clinic walls, the friendliness of the doctor, all these things can influence your experience of pain. But let's wrap it up. Remember, rule number one is don't panic. You don't need to panic because pain has many different influences, and just because somebody told you that your posture is bad or that you're weak or that you have something wrong with your spine does not doom you to a lifetime of pain. If we can focus on some of the things in our control, like eating good food, getting good sleep, surrounding ourselves with good people that we love, doing work that's meaningful to us, having beliefs and attitudes that are hopeful and optimistic regarding our chronic pain, taking care of our mental health, and living in a healthy environment, then even if you do have crappy posture, you're weak, and there's a little bump on your spine, then it's outweighed by all these other really good things in your life. And in that case, you're much less likely to experience pain. So don't panic, because you're gonna be okay. And then here are all of the references for this presentation. Leave questions in the comments, and I'll see you in another video.